Congenitally corrected transposition of the great arteries is a condition in which there is atrioventricular and ventriculo-arterial discordance so that the circulation is physiological. The right atrium connects to the morphological left ventricle, which in turn connects to the pulmonary artery so that systemic venous blood reaches the pulmonary circulation. The left atrium is connected to the morphological right ventricle, which ejects to aorta, thereby ensuring that pulmonary venous drainage reaches the systemic circulation. Since the atrioventricular walls are a property of the ventricles, the systemic right ventricle in this case has a tricuspid valve. Hence, it is prone for deformities affecting the tricuspid valve. In up to 70% cases of congenitally corrected transposition of the great arteries, systemic AV valve may be displaced inferiorly, the Ebstein's anomaly. This abnormal systemic AV valve is an important cause for regurgitation rather than ventricular dilatation and dysfunction. Systemic AV valve regurgitation was the only independent predictor of death in congenitally corrected transposition of the great arteries in certain series. The prognosis becomes poor when systemic AV valve replacement is delayed and the systemic ventricular ejection fraction falls significantly. 10-year survival after systemic AV valve replacement was only about 20% when the preoperative systemic ventricular ejection fraction was below 44% in earlier studies. In a series from Mayo Clinic, it was found that late systemic ventricular ejection fraction beyond 1 year was preserved in 63% of those who underwent surgery with systemic ventricular ejection fraction of 40% or more, while it was seen in only 10.5% of those who underwent surgery with systemic ventricular ejection fraction less than 40%. A systemic ventricular ejection fraction of 40% or less, subpulmonary ventricular systolic pressure of 50 millimeters of mercury or more, atrial fibrillation, and a poor NYHA class 3 or 4 were the preoperative factors associated with late mortality. The authors recommend that systemic AV valve replacement in those with congenitally corrected transposition of great arteries and systemic AV valve regurgitation should be recommended before the systemic ventricular ejection fraction falls below 40% and the subpulmonary ventricular systolic pressure rises above 50 millimeters of mercury.